Welcome back to our channel, your place for trusted medical information explained simply. Today we re-diving into a gut issue that more than meets the definition of a gut punch. Imagine your gut, a fast zoom into the inner lining, and suddenly we refocusing on those tiny lymphoid tissues scattered throughout the intestines. A bustling city of immune cells, usually busy fighting off harmful invaders. Now picture this. The very cells that are supposed to be your protectors, going rogue, multiplying uncontrollably, and staging an attack against their host. This isn't a sci-fi movie, it's reality. And it's happening silently, insidiously. We're talking about gut lymphoma, a disease where the line between defender and destroyer gets blurred. If you here because you noticed some unusual symptoms, or maybe you just curious about your gut health, stick around. By the end of this video, you'll understand how to spot the early signs of this disease, why it often goes undetected for so long, and what exciting new treatments are changing survival stories. So let's get started. What exactly is gut lymphoma? Gut lymphoma originates in the lymphocytes, those specialized white blood cells that are the cornerstones of your immune system. Their job is to identify and neutralize threats, keeping you healthy. In gut lymphoma, these defenders turn into aggressors. They multiply rapidly and abnormally within the walls of your digestive system. More specifically, it can start in the tissues of your stomach, small intestine, or colon. It's not your gut lining cells that are mutating like in colon cancer, but the very cells that should be protecting it. Why does it happen? What triggers these lymphocytes to stage a mutiny? Well, several factors can set the stage. Chronic inflammation in the gut can create a hotbed for abnormalities. Certain infections like Helicobacter pylori, a bacterium that infects the stomach, can increase the risk. And a weakened immune system, perhaps from another condition like HIV, can also play a role. But here's the twist. Unlike many gut problems that are influenced by lifestyle, gut lymphoma isn't driven by what you eat or even your stress levels. It's a disease of the immune system itself. Now, before we move on, let's break down the word lymphoma. In simple terms, lymphoma means cancer of the lymph nodes or lymphatic system. It was derived from the Greek words lympha, meaning water, and ides, meaning form or appearance. The term was coined by the French pathologist Jean-Nicolas Payer in 1893, chapter 3. Symptoms that fool you. When it comes to recognizing gut lymphoma, you might be scratching your head wondering how do you spot it. After all, it's not like you can see those rogue immune cells multiplying inside you. Here's where things get tricky. The early stages of gut lymphoma often mimic common gut issues. We're talking about stomach pain, bloating, diarrhea, and even unexplained weight loss. Fatigue, fever, and night sweats can also make an appearance. These symptoms are so nonspecific that they can easily be brushed off as irritable bowel syndrome, indigestion, or some other less serious condition. Let's take a moment to look at a few of these symptoms in detail. Stomach pain is a common symptom of gut lymphoma, but it's not the kind of pain that always strikes. When you indulge in that spicy dish you know you shouldn't have, it's a deeper, more persistent ache that lingers even when you've had some antacid. Bloating is another symptom that sets in, making your abdomen feel uncomfortably full and distended. It's not just the feeling you get after a big meal, it's constant and can be quite painful. Diarrhea, too, can be more than just a one-day affair. With gut lymphoma, it becomes a frequent visitor, often persistent and unresponsive to over-the-counter remedies. Unexplained weight loss is a red flag that shouldn't be ignored. If you're shedding pounds without changing your diet or exercise routine, there could be an underlying issue brewing. And finally, let's talk about fatigue. It's not just feeling tired after a hard day's work. It's an overwhelming exhaustion that seems to follow you everywhere. Even after a full night's sleep, you might still feel drained. Night sweats are also a sneaky symptom. Imagine tossing and turning in bed, not because you're having a nightmare, but because your body is working overtime to fight a silent battle. The challenge with these symptoms is that they keep you guessing. They're like puzzle pieces that don't fit into any obvious picture. It's easy to write them off as everyday annoyances rather than clues pointing to something more serious. That's why many people ignore these symptoms or treat them with over-the-counter solutions instead of seeking medical help. By the time a gut lymphoma is diagnosed, it often reaches a stage where it's more advanced than any of us would like. Chapter 4. How do doctors catch it? Getting a diagnosis of gut lymphoma is no easy feat. It requires a combination of upper endoscopy, careful visual inspection, and the extraction of small tissue samples known as biopsies. Let's break down how this process works step by step. Upper endoscopy is the first line of defense. It allows doctors to directly visualize the internal lining of the digestive tract, particularly the esophagus, stomach, and duodenum, the first part of the small intestine. During the procedure, a thin, flexible tube equipped with a camera is inserted through the mouth and gently advanced into the digestive tract. This allows the gastroenterologist performing the procedure to examine the inner surfaces of these organs, looking for any abnormalities such as ulcers, inflammation, or suspicious growths. In the case of gut lymphoma, the telltale signs might not be immediately visible during endoscopy. That's why the next step involves taking biopsies of the affected areas. Tiny samples of the gut lining are collected using forceps that are attached to the endoscope. These samples are then preserved in a special solution and sent to a pathologist for examination under a microscope. But why are these microscopic examinations so important? Well, it's because gut lymphoma is a type of cancer that affects the lymphatic system, which is a crucial part of the immune system. Identifying this type of cancer requires trained eyes to spot the abnormal growth of lymphocytes, a specific type of white blood cell. Pathologists are the experts in identifying these cancerous cells under the microscope. They can analyze the size, shape, and structure of the cells to determine whether they are cancerous, and if so, what type of lymphoma it is. If the biopsy reveals that the patient has gut lymphoma, further tests may be conducted. A positron emission tomography, or PET scan, can help determine if the cancer has spread to other parts of the body. Chapter 5. Treatment and survival stories. Once diagnosed, the treatment journey for gut lymphoma often begins with chemotherapy, which remains the primary weapon in the fight against this cancer. However, recent years have witnessed a shift towards more targeted therapies. Monoclonal antibodies are one such advancement. These special medications focus on specific parts of the cancer cells, triggering the body's natural defenses to attack them. It's important to remember that gut lymphoma is not a one-size-fits-all disease. Treatment plans are customized based on various factors, including the type of lymphoma, its stage, and the patient's overall health. For instance, certain gut lymphomas linked to bacterial infections like Helicobacter pylori offer a unique opportunity. Antibiotics can be used to not only treat the infection, but also halt the disease in its tracks. Yes, you heard that right. Antibiotics fighting cancer. It might sound unconventional, but it's real and it's effective. Excitingly, clinical trials are testing new therapies that show promise in replacing traditional chemotherapy. These groundbreaking approaches could target the rogue cells before they spread, offering hope for better outcomes. Chapter 6. Hope on the horizon. As we wrap up our discussion about gut lymphoma, it's essential to remember that every symptom, every diagnosis, and every treatment is a piece of a unique puzzle. Your body is constantly sending you signals, and understanding these signals is the first step towards proactive health. If you found this video informative, don't miss our upcoming video on rare stomach cancers you've probably never heard of. Stay subscribed and keep asking questions. Your curiosity could lead to a healthier tomorrow. Now, I want to leave you with a final thought. If you were experiencing unexplained gut symptoms for months, would you push your doctor for more tests or wait and see if it goes away? Drop your answer in the comments below. And remember, your health journey is a shared journey. Stay curious, stay informed, and stay connected. Thank you for watching.